Hello, and welcome to another episode of Myth Busting on the 5 Minute Check-In. I'm Dr. Ankita Sagar, and today we're turning the tables and placing our longtime host, Dr. McGinn, in the hot seat. Welcome, Dr. McGinn.
Well, thank you for having me, and thank you for putting me in the hot seat. It's a pleasure to be here.
Thanks for coming. We have a really important topic to talk about. Lots of buzz around this full body preventive scan. Whenever I'm driving down I-95, there's always at least one billboard that tells me I, as a healthy individual, need to make sure I get a full body scan. I need to catch that health issue early because it is absolutely necessary that I get it done. So tell us, is that true? Should I get a full body scan?
Well, this issue continues to come up and down and throughout our time period. When I was an intern, I remember seeing an advertisement. Come and bring a friend, get one free for your CT scan for your total body. And we're going to say this at the beginning. We'll probably say at the end. There is no evidence to support doing this, so not a good idea.
Especially, we're talking specifically asymptomatic adults, healthy, no issues at all.
Exactly. So whenever we talk about this subject, as you just mentioned, we need to make sure everyone knows we're talking about. This is not somebody being sent for a workup or scan or some issue like that. These are completely healthy people going for screening. And there are 5 major reasons that I like to highlight why we should not be doing this. There's direct harm to the patient. And actually, then we'll talk about direct harm to society. There's the false positive rate. There's what we call the unintended consequences, which we can also get into a little bit more. Obviously, there's tremendous cost involved with this. And there's what we call the opportunity cost of not doing what you should be doing as opposed to doing this unnecessary test.
Perfect. So let's get into it. The first one you mentioned, harm. What are you thinking about in the harm category?
So you can look at harm in a lot of different ways. You can look at the actual, if your CAT scans, the actual risk from the radiation exposure, well, not very high, but 1 in 2,000 have a slight increased risk for cancer. However, many folks, and we'll talk about this, get follow-up scans performed, right? So the risk is not so much in that initial scan, but it's all the follow-up scan. So you layer the radiation exposure upon radiation exposure upon radiation exposure. And also for MRIs, you have similar issues as you get repeat MRIs performed.
Great. So we have the harm from the test itself and the follow-up, but then you also mentioned false positive rates just a couple of seconds ago. What is that about? How should we be thinking about it when it comes to scanning?
So the data is interesting. There's a lot of different studies looking at the false positive rate. In some of the original trials, this is now in a little more high-risk people in the 50 to 7-year-old range, but the false positive rates were upwards of 30%. I mean, as low as 2%, but depending on the study. So if you think about that, those are people all that are going to get positive scans. And what the recommendation is, get another scan in 6 months, in a year. So there we have, again, the piling on, we call it the wake of a diagnostic test, all the follow-up tests that occur.
Right, like the cascading of multiple testing afterwards.
Exactly.
Now, that can lead to a lot of anxiety, right? And other unintended consequences. You mentioned that that's a consideration. How do you think about behavioral health concerns or anxiety or unintended consequences, either from the initial test or those follow-up cascades that we're trying to follow?
This is a big issue. I've had many patients in my day as a primary care provider where the patient, went and got this total body scan and the whole big workup, and they come back and they say, hey, the report says my spleen is large, but not to worry about it. It's not cancer. I've had patients go into deep depression and anxiety related to this. And as you repeat the scans, you're just repeating the injury of discussing this with them. And they really do struggle with this. So it's a big problem.
So there's the test itself, how we interpret the test, the follow-up cascade, and the costs associated with that. But then we also talk about a little bit about the financial cost of the test itself.
Yeah.
I'm sure you've been posed this question multiple times. Well, what if I can pay for it out of pocket?
Exactly. I mean, you're driving down the highway, you're going to go pull over, exit, 24 on the 95 there, and you're going to take out your Amex and you say, I'm all done here. Now, again, think back, whatever that false positive rate is, if it's 5 to 30%, all those follow-up tests are going to be charged to your insurance or Medicare. So the inherent cost is multiplicative downstream. People often, oh, I paid for this. No, you didn't, because you didn't pay for all the follow-up tests, the potentially unnecessary biopsies that occurred. Those all add to the healthcare costs of the country.
And then you also mentioned a really important term, opportunity cost. Things that we may have missed because we got this full body scan, but we really didn't get a true picture of cancer screening. How do we think about cancer screening, and what has worked, and what is your approach to that?
Well, we've been talking about this on the 5-minute check-in and updating on all the risk-based screening that we should be doing and thinking about, the numbers of people who are eligible for colon cancer screening who actually receive colon cancer screening is anywhere from 60 to 70%. So we're missing lots of people. And the more, this discussion around total body scans will distract us from doing all these other type of cancer screening.
Right. And there's a couple, right? So we've got our breast cancer, colorectal cancer, lung cancer screening, cervical cancer, prostate cancer, and of course, the largest organ in the body, your skin cancer
Skin cancer
screening.
screening, absolutely. And as a fair person, I need to be skin cancer screening. So, this could distract us from doing really evidence-based, risk-based screening that is clearly effective and save lives.
Okay. So as a healthy person, what do you think about full body scans for healthy people? Are they helpful and worthwhile? Or is that myth busted?
That myth is busted.
Perfect. Thank you, Dr. McGinn, and thank you to our audience for chiming in. Please send us your ideas for topics for the future, and we will see you at the next myth busting episode.